You're watching Eyewitness News at 9 on the CW7 with Noah Alatza, meteorologist Stacey May, and sports with Blake Sandlin.
The Vanderburgh County Jail is dealing with more COVID-19 cases among inmates. Sheriff Dave Wedding tells us today there are still 14 active cases right now inside of the jail, most of them in the female unit. We're told that some of those positive cases are coming back asymptomatic, but Wedding says that many inmates are simply refusing to get vaccinated. So we sat down with him today to learn more about the situation and what's being done to help. And Sheriff Dave Wedding joins us right now. Sheriff, always a pleasure to see you. Thank you for your time on this Sunday. We really appreciate it. Let's get right into the questions, Sheriff Wedding. Obviously, on Friday, you told us that there were 14 active cases of COVID confirmed inside of the Vanderburgh jail, mostly in the female unit. So let's start. Do you have any updated case numbers as of this evening?
That's the number that's still holding as of now, 14. And our medical staff and confinement staff are working together to make sure everybody is safe as we can.
And Sheriff, I wanted to ask you, obviously we've all lived through this pandemic now since early 2020, but what kind of plans maybe do you have in place right now to try and prevent or maybe even slow the spread continuing inside the jail?
Well, it's no secret that COVID has been around since about February of 2020, and the Sheriff's Office has worked closely with the Health Department and our professional health care provider to put plans and guidelines in place to try to protect our staff and our inmates as well. When you have a population like a jail where they build very small facilities with large volumes of people, it's pretty easy to transmit COVID. During the height of the pandemic, we had built specialized quarantine cells, and we had steps in place to quarantine people throughout their incarceration. As COVID subsided, we did away with a specialized unit, and we've just been keeping an eye on the inmates. And this is one of several cases where we get little spikes in the COVID infestations in the jail. So we take the people, we quarantine cells, we treat the people who are infected, and we just kind of ride the storm out each time.
And Sheriff, to that point, do you have any idea how this even got into the jail in the first place? Any contact tracing protocols that you guys have in there?
No, I mean, if you look at the cases here in Vanderburgh County, I think it's tough for anybody to absolutely pinpoint the origin of somebody that's been infected by COVID. A lot of times there's suspicions or, who have I been with the last 3, 4, 5 days, last 2 weeks. And the jail is an interesting place because we arrest anywhere from 25 to 40 people a day, so we get that many new people off the street, and oftentimes the people come in under arrest, they're not following good health care guidelines. They live a little risky, and they don't or can't tell us who or where they've been hanging out, and they're just ripe to transmit something if they've been infected by somebody out in public.
Right. And Sheriff, I remember you also mentioning to me on Friday that, you have a lot of inmates in there that are simply maybe not wanting the vaccine, refusing the vaccine, whatever it might be. Do you have any idea why that is? And what can you really even do going forward?
Well, the Sheriff's Office has worked with the Health Department and our professional health care provider and have offered vaccinations on multiple occasions to inmates in custody. We've had a large number of inmates that have just refused to take the vaccine. And they're no different than the people out in the public, that there's people who are skeptical of the vaccine. They won't take it. So we've encouraged them. We try to incentivize the vaccine like the other sheriffs and jails across the state of Indiana. But there's just some people, they're leery of the vaccine because it came out so quick and they think there's going to be some negative impact down the road.
Sheriff, do you have a message for, let's say, family members who are watching this tonight, worried about maybe a loved one in the Vanderburgh County Jail right now, who say that they might be concerned about possibly contracting COVID-19? What would your message be to those families?
Well, if you look across Evansville, Vanderburgh County, the state of Indiana, certainly across the nation and the world, COVID-19 is impacting somebody in any place within the world that we live in. Somebody's catching COVID. Jails are no different. Best thing I tell people is stay out of jail. Don't commit crimes and lower your risk of transmission. just by being a good person. But if you come into jail and you happen to have COVID, maybe you brought it into jail with you, we have nursing staff that's around the clock that will treat the sick. We have a specialized unit, like an infirmary, that treats people who have COVID-like symptoms. Generally, the people that we have seen in our jail have not been really sick, but they've had like flu-like symptoms. We've watched them diligently during the healing phase. Many of our inmates that contract COVID are asymptomatic, but we still keep an eye on them. And we're prepared to treat people. And when we can't treat them, then we send them to the local hospital.
All right. Well, Vanderburgh County Sheriff Dave Wedding, always a pleasure. We really appreciate your time tonight. Thank you.
Thank you, Noah.